the government wants to be able to control our health care. The first way it's going to do it is because it's going to be by placing a silent bureaucrat in the room with your doctor. Make no mistake about it. When I talk to my patient, and when you talk to your doctor, there will be a list of rules silently floating around in my mind. And if they're not there, they're going to be in a computer. And they're going to tell me what I can and cannot do for you if the government takes over healthcare. If the government takes over healthcare, they will do their best to ration the care that you receive. How are they going to do this? They're going to do this through electronic medical records. Electronic medical records seems to be a nice little bait, but it's a bait that I'm trying not to bite. Any doctor would like to speak to another doctor halfway across the continent and find out what kind of treatment was provided to their patient. Any doctor would like to click on a mouse and see what kinds of medicines our patients are on. But that's not what the fashioners of the present healthcare reform bill want to do. What they want to do is not provide me with the ability to look at your medical records somewhere across the world with your permission. What they want to do is they want to keep your medical records in a centralized, government-run database. That was present in the S-chip legislation, and it's also present in the Nancy Pelosi bill presented to Congress at this time. I cannot conceive of a more threatening assault on our privacy and our individual liberties than the government maintaining our medical records. So do not be fooled by, and I also implore my fellow physicians not to be fooled by this concept of trying to help us by giving us electronic medical records. Really, all I want from electronic medical records is to click on a mouse and see your digitalized records when you give me permission to do so. But I don't want the government to keep it, and I don't want the government to keep tally on how we all do when we provide care. Because that's going to lead to the second way that they're going to invade our exam room. And that is through comparative effectiveness research. You've heard of that term? Who's heard of CER? Good, I'm glad I'm here. I want to tell you all about it. Comparative effectiveness research is what politicians want to convince us to believe is science. It is not science. Physicians are scientists. Many of the people who support us are scientists. We deal with outcomes studies. We deal with randomized control studies, and we deal with placebo.